Well, hello, welcome to Outside the Room. I'm CG Funk. Now, most massage therapists today recognize the famous James Waslaski. He's internationally known for his cutting-edge continuing education workshops. He travels the world teaching a technique which he calls integrated manual therapy, and he teaches to massage therapists, chiropractors, physical therapists, athletic trainers, osteopaths, and many more. Now, James is here in the studio to show us some very effective techniques for working with shoulder pain and injuries.
Hi, I'm incredibly thankful to be back in Outside the Room, and I want to thank CG Funk and Massage Heights for this opportunity. I'm about to share what I'm most passionate about, which is treating complicated shoulder conditions and making it actually simple to do. So today we're going to look at conditions of the shoulder. We cannot diagnose, but I'm going to look at things like non-surgical intervention for rotator cuff injuries, thoracic inlet, thoracic outlet, clavicular ribs, scaling work. But as I go through it, I'm going to explain each piece of this. So what I usually start with is I do a quick evaluation. I just ask the client to put their palm up and they try to abduct their shoulder. And usually you'll find in most of your clients that it'll come to about 160 and then it'll start to push back at you. So that's an impinged shoulder, and we're going to talk about treating that. A lot of people have trapped nerves, so they have numbness into the arm. So the first thing I'm going to do is one of the things that traps the nerves in the shoulder is the clavicle. So this particular bone usually is fixated, and that's why you can't abduct your shoulder. So we're going to shorten the sternoclavicular ligament. Clinically, it would be called positional release of the sternoclavicular ligament. That unlocks the clavicle. Then I just want the brain to know that I've created a change, so I let the client feel the clavicular motion that I've restored with that. Once I do that, I'm going to come around to the other side and I'm going to work on our scalenes. And I know that most people are really excited to see scaling work, so I'm going to be right here under that clavicle on that first rib. And we know that the scalene's attached to the neck, and the nerves in the neck are trapped by the scalenes. So to stretch your anterior scalene, I'm going to gently go under your neck, and you're going to take a deep breath. You're going to rotate to my side as far as you can rotate to the left. And then I'm going to come across and you're going to exhale. And the reason I have the client exhale is then the rib drops. So I'll do that one more time. Deep breath. And as you rotate left, you're going to exhale. And I pull the rib down and then I stretch the scalenes between the rib and the neck attachments to release all the nerves in here. And then for the middle scalene, she's going to take another deep breath. And as she exhales, I'm just going to bring the head straight across, and that gets the middle scalene. And what that does is oftentimes people have carpal tunnel or thoracic outlet, but if you don't treat the nerves in the neck, you can't treat the nerves in the shoulder or the arm. And then the common factor is most people have tight pecs. So I'm going to start by just getting the body to relax. And I'm going to just get into pectoralis major. It's a warm-up. It's a little bit of a warm-up of the tissue here. Just a little bit of pec major work. And then what I'm going to do is I'm going to come in and do a little pec minor PNF work. So push up into my hand gently and relax. And I stretch out that pec minor muscle. And then from there, I'm going to come across one more time and do a little bit of mop posture work. And this is where you have to ask permission. I would say it's okay to put your hand here because I want to access this muscle. It's okay if I touch your hand. It is okay if I just work this area of your body. So asking permission is really just a classy thing to do. It's the right ethical thing to do. So I'm just going to loosen up the fibers of pec minor a little bit across this way. That kind of releases the brachial plexus of nerves. And before I stretch pec minor, I have to do something else. As you noticed in the beginning, she had an impinged supraspinatus, something was pushing back at us. To treat that, there's a middle deltoid muscle I'm going to loosen up. I'm just going to warm that up, and I'm going to slightly decompress your humeral head. And for visual reasons, I want to show this really quickly on the model. When you decompress the humeral head, you increase subacromial space. So the idea is that I want to get rid of the pressure on the bursa and the subacromial space and the supraspinatus tendon. And then I can come up and I can stretch out the pec minor, which is this muscle to free up the nerves in here. And then I come to the neck for a minute. In the cervical area, there's a lot of trapped nerves in there. And if these nerves are trapped in the neck, the symptoms are in the shoulder. So I'm just going to clean up the lamina grooves in here. I'm going to do a technique that encourages better opening and closing of these stuck facet joints, encourages, because I can't adjust. It has to be gentle work. And I'm going to put the curve back in the neck. That's going to help with shoulder problems. So basically, I go into the neck curve, and I just do a little bit of pushing up and then decompress the neck, and just really strong traction. And then what I'm going to do is I'm going to just clean up those laminar grooves in her neck, get rid of adhesions in the groove. So I'm in the laminar groove with my fingers. As I clean up the laminar groove, I kind of get the fibrosis off those nerves. And then I just kind of sidestep to encourage closing and opening of those stuck facet joints to treat trapped nerves. And then, of course, the bonus stretch is this one. And then I check the neck rotation. She's restricted, so I look at the SCM, which is this muscle, and I start to release it. Real gentle, just gentle pressure. Everything is light. And then you look down with your eyes, and that stretches your occiput. And as soon as I do that, you'll notice that you can rotate all the way to the left without any restrictions in your neck. So some of it seems too easy to be true, but the SCMs actually, the truth is they don't attach to the mastoid process. They attach to the occiput. So when I'm working the SCM and working under the occiput, I'm really getting that neck to flex at the occiput, and that's why all this rotation comes back. So nothing is forceful, everything is gentle. And I'm working the opposite side, same thing, so that we're going to get good right and left rotation back in the neck. And with a healthy neck, we can have a healthier shoulder. So as I come back over here, what I want to do is I'm going to do one more stretch here, and you'll notice a difference in the range of motion here. And you'll notice that the arm now comes up, and I check my work. I check what the changes I made. And then in just a couple of minutes, in just a minute or so, we're actually going to go side lying. And in side lying, what we're going to do is we're going to release her upper traps and her lats and look at some diaphragmatic releases and look at some fixated rib releases. And we're going to do that in the side lying position in just a minute. Once they're side lying, you want to work on the upper traps, the middle deltoid. You want to check the subacromial space. So I'm just going to have nice, relaxed hands, real soft hands. They shouldn't feel your knuckles. They shouldn't feel any pressure points. You're just conforming to the tissues, moving down through the upper trapezius. And just as a note, I've been doing this for 33 years, never had a massage-related injury because of good body mechanics. I think that's important, that you're not all bent over in your neck, that your arms are locked straight, that your work is coming from your hips. So as we get into those upper traps, lengthening those, going around the acromion, going into the interposterior deltoid, and then going down the middle deltoid allows us to decompress the humeral head to increase subacromial space off the bursa sac and the supraspinatus tendon. Then as I come around to this side, oftentimes I'll just put the arm above the head. If it's comfortable, I'll do that. If it's not, I'll just put it forward of the body. And then I'm just going to come in here and do a little bit of lat work. So you're going to take a deep breath. And as she breathes, she's affecting rib movement. And we're just getting into the lats a little bit here. And you can do just hand work here. You notice my hands are flat around the back. Take some deep breaths. And as you do that, I lengthen on the exhale, I lengthen the lats and I rotate the ribs back to help those thoracic facet joints. So the direction of therapy is moving everything to the back. Deep breath. And as they exhale, you can move back around this way a little bit. The last thing I'm going to do before we go prone is I'm going to just relax her shoulder. I'm going to get her to relax. And I'm going to find the acromion, and I'm going to just show this for the model for 1 second. Once more, I'm going to increase subacromial space because that's so important. Very few therapists do that, so they end up working with bursitis and supraspinatus impingement. So from here, I just get her to relax. I get the middle deltoid softened, and I just do a little bit of humeral head decompression, real gentle work. The key of balancing the rotator cuff muscles is you want to lengthen the muscles in the front, and you want to decompress the humeral head from the acromion to increase subacromial space back there. And then from there, we're going to go prone, and we're going to relax all the back. We're going to move all this tissue in the back. We're going to move everything back towards the spine. We're going to check out her lamina groove. We're going to reposition her scapula. And pretty much that's going to put everything back where it needs to be in the body. Now, based on research and clinical studies about fascial lines of tension, typically the muscles in the back get lengthened because the muscles in the front pull your shoulders forward. So in the front, you notice we brought everything back to make those short muscles longer. And in the back, we're going to shorten and relax everything based on the work of people like Ida Rolf. We're just repositioning the fascia. So you basically start at the elbow, and you drop your body weight in and you do some slow, deep myofascial spreading. You're trying to really relax the triceps because they're overpowered by the biceps. So as we direct the tissue back in this direction, notice the slow, deep pressure. So the word deep can have different meanings. Deep should never be painful. Deep should just be the pressure that the client can tolerate. And that comes with experience, of course, doing lots of massages. And then when we come back here, we just want to push the tissue, infraspinatus, teres minor. We want to push everything back towards the spine. And we want to get those erector spinae back up on that spine so they can encourage better closure of oftentimes stuck open thoracic facet joints. And that's really a healthy thing to do. So I'll do that one more time. I'll just do a couple passes through here. So the hooking of the fascia requires very little lubricant because if you glide too much, you're not going to move the deeper tissues. So the pressure is slow. It's in at a 45-degree angle. Here's posterior deltoid. You're getting that to relax. There's the infraspinatus and teres minor. Now, what I tell people if they don't want to learn muscle groups is just basically push the tissue from the elbow to the spine. Because the simplicity of body work is you're just putting tissue back where it belongs, really. And the thing about scapula is this bone right here is typically they're upward rotated. So with a nice relaxed hand, you're just pulling the scapula down, but watch out what you're doing with this thumb, just real relaxed fingers so you're not anterior to the pecs. You're on the upper traps and you're pulling the scapula back down. This relaxes those oftentimes weak rhomboids. This repositions the levator scapula for a better cervical outcome in here. So this gets more relaxed. And once you push the scapula back where it belongs, then what you're going to do, my favorite ever, if you can only learn one technique from this workshop, from this presentation, go under pec minor, very gentle, just be on pec minor, be away from the chest area, just give a little bit of lift, and that stretches pec minor to free up the scapula. Then relax the capsule, which is called position release, and pull in synovial fluid and pyloric acid. So with nice relaxed fingers, you're pulling the scapula off the rib cage. People say it's glued to the rib cage, and it's not. It's just a tight pec minor. Then you're going to the anterior deltoid, nice relaxed finger pads. You're doing positional release of the capsule, which is what holds the humeral head in place. Then you're pulling in synovial fluid and pyloric acid. This is really good if they're told they have adhesive capsulitis. And then you're decompressing the humeral head again off the acromion to increase subacromial space to get rid of bursitis and supraspinatus impingement. And then I'm going to walk around, and one of the things that we want to know is that the upper trapezius restricts access to the supraspinatus tendon, so just get in and warm it up. Just get in and warm up that tissue. And that way, if you do trigger point work or whatever you do, you have a nice myofascial warm-up before you go into any tender points. And just kind of hooking that fascia, relaxing that supraspinatus tendon. And then what you want to do is you want to go in the lamina groove. So you're right in the groove here. And you want to just drop your body weight in. You want to push the erector spinae back into the groove and drive it down towards. So if they had a forward thoracic curve, you would want to go downward because you want to reduce the curve. So a lot of people have that forward thoracic curve. So you want to go downward. That gets the erector spinae back in the groove. And then, of course, sometimes they have facet joints that are stuck open. You just take your thenar eminence. You're real careful not to be on the spinous process. And with your thenar eminence, you just kind of go, I call this the Texas twister since I'm from Texas. I just kind of rotate the spine a little bit and just a gentle compression. We're not allowed to do any high velocity thrusting, but this encourages better opening and closing of stuck thoracic facet joints. And then, of course, they like you to do a nice technique to get some blood flow going into those ischemic rhomboids, middle trapezius. Check out that lamina groove a little bit. And just get all those tissues to relax. You can come back and warm up the neck muscles again. Getting here and just loosening up this fascia. And the key here, and I'm going to repeat one of the pieces, critical factor, there's a lot of trigger points back here. And what you do is when you lengthen the upper traps, it relaxes the rhomboid. So these become longer, these become shorter, everything becomes more balanced, everything is less ischemic. And then I just kind of finished with my signature trademark technique, which is the pec minor release. And be careful with your hand placement. You're just on the pec minor, barely with your finger pads. Once again, stretch pec minor, that opens up that thoracic outlet. Do positional release of the capsule to bring in more synovial fluid, pyloric acid, and then just drop the humeral head off the acromion, and then just finish with something that just feels good. There's a lot of sympathetic stress in the world. So when people have tissues brought back to where they belong, and you finish with nice, calming words, relaxing strokes, it just feels amazing at the end. So again, always engaging the tissue to where it needs to go back to, so there's no long, short muscle relationships. So kind of in a summary of what I've done this whole sequence, I've lengthened the muscles in the front to roll that shoulder back. I've lengthened the muscles in the top to drop that humeral head to treat bursitis and supraspinatus impingement. And to release myofascial pain and trigger points in the back, you really have to shorten these tissues so that they're not stretched long, which is why we're loaded up with trigger points. And again, you're just going to get that finishing touch where you're just hooking into that fascia, checking out that lamina groove, and just putting it all together so that it just feels better, just kind of hooking all that tissue. I just love, everybody loves their rhomboids work done, but when they're relaxed, when they're shortened and relaxed, it's a whole lot better because you're not dealing with a lot of trigger points in there. So hopefully you've enjoyed this muscle balancing technique, this protocol for thoracic outlet adhesive capsulitis in a longer course. You can go to my website, www.orthomassage.net. I teach 45 weekends across the globe. Every weekend I'm on the road somewhere all over the world. And I hope you go to our website and check out the longer courses where we do a lot more assessment, a lot more clinical reasoning, and a lot more corrective exercises. Thanks for this blessing and opportunity today.
Well, that was a really wonderful episode with James Waslaski. I want to thank Massage Heights, ABMP, and ASCP for sponsoring Outside the Room. And I will see you next time. From my heart to your heart, namaste.